morning. I'm Jessica, your physiotherapist today, and you are here for lower back pain.
Yeah.
Okay. So, how much pain are you in right now? From 0 being no pain to 10 being the worst pain.
7 right now.
7.
Yeah.
Oh, that's quite high pain. All right. And
Or 6. Yeah.
6 or 7. Okay. Now, last time we already tried a hot pack, and that was quite good for you. Today, you told me that you have an infrared lamp at home. So we're going to try and use it today to see if it helps you, and then you can continue using it at home, and I'll teach you how to use it at home.
Okay.
Does that sound okay?
Yes.
All right. So have you ever used the infrared lamp before?
No, I didn't.
Not yet. Okay.
Yeah.
So we have to check some contraindications. So it's really important that that you have normal skin sensation. So I will test your skin sensation. It's also really important that you observe the distance between the skin and the lamp. Because the closer you put the lamp, the hotter it will be. All right? And you don't want to have a very hot feeling. You just want to have a comfortable warm feeling. All right. So let me review some of those contraindications that we talked about yesterday when we did the hot pack. We have an additional one for the infrared. So we can't have any jewelry or any metal in our clothes, for example, when we're using the lamp. So if you have, I think it's okay to wear the necklace because we're not treating the upper back, we're just treating the lower back. But it's important that belt, probably a good idea to remove belt if there's any metal studs, or if you have jeans that have the small metal studs, it's also good to remove that and wear some clothes that don't have any metal in them. That's very important because it will preferentially heat up, and then it will cause a burn, of course. All right.
I don't think
Yeah, you should be okay. Yes. So there's no belt. Also, do you have any photosensitive conditions that would be aggravated by sunlight? Because
no, I didn't.
no idea. So you're
No.
okay to go into the sun and you don't have any skin reactions. Okay. So the contraindications are very much the same to a hot pack. So do you have any cancer? Do you have any tuberculosis? All right. Do you have any unstable blood pressure? Because sometimes if we use the infrared, it will cause some dizziness if you use it for a longer period of time and over a large area. So do you have any problems with your blood pressure?
No.
Okay. In that case, you haven't got cancer. We already checked that. You haven't received any deep X-ray radiation. I checked your skin yesterday. You still had some marks from the IFT treatment. That was okay. You haven't got the DVT. We already checked that. Okay, in that case, I think you're fine to go ahead. So we'll get yourself on the bed.
Okay.
Sideline facing the right side. And I will cover you up with towels first, but you need to remove your shirt.
Okay.
So in a real clinical placement, you would be making sure that all the curtains are closed, and you want to have a towel and then facing the right-hand side. If you want to use a pillow between your legs. So a lot of patients with back pain, they might have SI joint pain as well, so it's good to keep everything in a pretty neutral line. And just make sure that we cover the area that we're going to treat is going to be exposed, and the area that is not being treated should be covered fully to make sure that the patient is comfortable. So I'm going to put an extra towel over your shoulders to separate the treatment. Does that feel okay?
Yep.
So now we're going to do a hot and cold test. Again, make sure you do a good skin inspection. At this point, if you've remembered, oh, there's still something I need to ask, you can also ask. Now, I asked yesterday already about hemorrhagic conditions. You don't have any, right? So this one is cold, and this one is hot. And I'm going to test the skin on your back. Right, just let me know what you feel.
Cold. Hot. 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 Cold.
most commercial lamps, you have to keep at least a 50 centimeter distance. For this particular lamp, a 30 centimeter distance is okay to achieve a comfortable warmth. But obviously, it depends on the individual as well. So make sure you have your measuring tape and then you can measure the distance and just discuss with your patient whether it's a comfortable warmth. So during the treatment, you should not feel any heat. Alright, heat can cause a skin burn. We don't want that. You just want to have a nice, comfortable warmth. In the beginning, the treatment will probably just feel like a mild warmth, and that will slowly increase in intensity to the middle of the treatment when it should feel a comfortable warmth. If at any point you feel that it's too hot, please let me know. So it should be comfortably warm. This is now 30 centimeters from the skin surface, and the timer is inbuilt. So I will start the treatment now. And you can test the lamp by putting your hand in between the skin and the lamp, and it feels warm. Alright, so make sure that you're irradiating the area. It should be a flat surface area. And keep it at the recommended distance, and then just check with your patient. What do you feel? Very warm or a mild warm? Yeah, if it gets too warm, please let me know. I will come and check every few minutes. Please do not move. Alright, do not fall asleep. If you feel it's too hot, please let me know immediately. Okay, great. So there's an inbuilt timer in the machine, so it will count down 15 minutes and then it will stop automatically. So make sure you stay within range of your patient. Okay, end of treatment. Alright. So now it's the end of the treatment. It's just counting down. So I'm going to have a look at your skin. So there is some mild erythema. It feels warm. And how do you feel? Comfortable. Okay. Pardon? Nothing special. Okay. So will you be able to set this up at home? The important thing is at home that you don't, look into the lamp directly with your eyes, so try to avoid eye contact with it. Prolonged exposure to infrared has led to cataracts, but for treating the back, we'll look at the other way, so it's fairly safe to use. Alright. So, make sure you help the patient, remove the towels, recheck pain score, recheck the skin, and then you can do your documentation. Okay, so for my documentation, I would write down the modality that I'm using. I would write down the patient position, skin sensation checked, contraindications done, consent given, so everything is fine. And then I would also write down the distance of the infrared lamp to the skin, and also the time and the duration, and then afterwards what's improved. Maybe the range, maybe the pain scale, something